And then to 22, so participation, what do you need to know? So on slide 22, this is the Pick Your Pace approach for the Quality Payment Program, which I mentioned earlier, and hopefully many of you have seen this before. So again, what the Pick Your Pace does is it provides flexibilities for clinicians who have differing needs and differing abilities on being able to participate in the Quality Payment Program. There are 4 tracks. The first deals with participation in advanced alternative payment models. I won't talk about that in too much detail. We have separate educational sessions related to APMs. I will talk through, however, the 3 options that are related to MIPS, the test option, the partial option, and the full year option. And for clinicians who do not participate in any of these options, they would be getting that automatic negative 4% penalty, which we really want to avoid. We really want everyone to participate, even if it's very minimally, so they don't get that negative 4% adjustment. One other piece I wanted to call out, because we've received a number of questions related to this, is you do not need to tell us, CMS, how you want to participate under the Pick Your Pace options. You can just simply start reporting. You don't have to sign up for the Pick Your Pace options, and you can change your option throughout the year. If you initially think that you want to participate using the test option, and then you think you can participate a little bit more fully, you can go ahead and do that. You don't have to notify us of any of those changes. So let's dive into slide 23. So the test option. So what the test option is where you would submit just a minimal amount of data to us, and that would get you to the neutral point where you would avoid that negative 4% penalty. And so what I mean by a minimal amount of data, it could be as minimal as 1 quality measure, 1 improvement activity, or the base elements of the Advancing Care Information Performance category. Those base elements of either 4 or 5 required measures, that depends upon your addition of certified EHR technology. Again, you don't have to do all of these. You could just do one of these things and avoid the negative 4% penalty. Let's move on to slide 24, the partial option. So the partial option is if you want to participate a little bit more fully than just 1 measure, 1 time, or 1 improvement activity. So this could be where you participate for a 90-day period. It could be where you participate in more than 1 performance category. So maybe you want to do quality and improvement activities. And under this option, since you'd be participating a little bit more fully, your adjustment, so your payment, would be a little bit higher. One piece to note is that if you are looking to just participate for a 90-day period, the last full 90-day period begins on October 2nd of this year. So keep that date in mind if you want to report for a 90-day period. And let's move on to slide 25. So the full participation option. So the full participation option is if you want to participate in as full a manner as you can. So what this could look like is you could participate for a full year. It could be that you participate in all the performance categories. It could also mean that you don't necessarily participate in all the performance categories for a full year. And I know this can get a little confusing. So let's go to slide 26, and I can talk through this in more detail between the difference between the full year option and the partial option. So when we look at the full option and the partial option, think of these as options along a spectrum. So if you can participate for a 90-day period for one performance category, that's great. If you can participate for longer than a 90-day performance period for one category, that's even better. It doesn't have to be either 90 days or a year. It could be 120 days, 6 months, 9 months, 10 months, and it could be for any of the performance categories. One of the main takeaways that I want folks to really get from this is that the more you participate in the MIPS, that means the overall higher potential incentive you could earn, because that means that we, CMS, would be receiving more data, which means that your total numerical final score would potentially be higher.